This is Cable Channel 5, your local origination station serving the greater hub area.
Good evening. I'm Dr. Robert Peppercorn, and this is the Yuba Sutter Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. We have a fascinating program for you tonight as we go behind the scenes of a cosmetic surgeon's office in Yuba City. He will tell us about his work in the area of cosmetic plastic surgery. We will also have the opportunity to see his new computer imaging device that can show you what you would look like with corrective cosmetic surgery before any surgery actually takes place. This imaging device is the only machine like this in Northern California, and our exploration should be extremely interesting. Tonight in the pharmacy corner, our neighborhood guest pharmacist will tell us some important facts about antacid medications. Are Rolaids and Tums really safe? Well, we'll learn the answer to this question and others about antacids in the pharmacy corner tonight. Tonight's show will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. A drug used to relieve the chest pain of angina may also reduce the risk of a second heart attack among certain patients, according to a recent report. In a drug of 600 patients, diltiazem, one of the new groups of drugs called calcium blockers, reduced the incidence of a second heart attack by 51%, according to a new report in the New England Journal of Medicine. The drug could help about 400,000 people in the United States who each year suffer what are known as non-Q-wave heart attacks. Non-Q-wave heart attacks initially cause less damage than the more common Q-wave heart attacks, but are up to 4 times more likely to be followed by subsequent second or third heart attacks. Diltiazem expands the blood vessels while lowering the body's heart rate, easing and lowering blood pressure. Less than 5% of the patients in the clinical studies suffered any side effects from the drug. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's expert neighborhood pharmacists. Joining us tonight in the pharmacy corner is Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
I understand that people are constantly asking you about the safety of taking over-the-counter antacids because they have stomach distress and indigestion. They feel they just have to do something. Would you tell us more about these widely used products called antacids?
Certainly. Antacids are drugs which, when taken by mouth, react with the hydrochloric acid of the stomach contents to lower the acidity. They are prescribed by physicians chiefly for the treatment of excess acid and gastric ulcer, and are used by the general population for a large variety of symptoms. The goal of antacid therapy is to reduce the concentration and the total load of acid in the gastric juice. This is not difficult to do. However, the effects are temporary and disappear when medication is discontinued. 3 factors have an important bearing on the effectiveness of antacid therapy: the neutralizing capacity of the antacid, the treatment schedule, and patient compliance. Acid neutralizing capacity, or the ability to react with the acid in the stomach, varies according to the product used and individual patient response. The treatment schedule is also important to gain the maximum effect from the antacid. Infrequent doses are less likely to provide sustained antacid effect than more frequent ingestion of the same total quantity of antacid in smaller doses.
My viewers and I look forward to you returning to speak in the pharmacy corner on some future Medical Explorer programs.
I'd like to do that. Thank you.
Thank you very much. Now, on with the Medical Explorer. Have you ever wondered what you might look like with a little corrective cosmetic surgery? Have you ever thought what you might be like with a smaller nose or a larger chin? Well, there's now a new device that can let you see your new self even before undergoing these surgical procedures. Let's learn more about this new machine and learn more about plastic surgery as we visit the office of Dr. Gordon Mitz. It's a pleasure to be back in the office of Dr. Gordon Mitz. This time, though, we're in his new facility in Yuba City, and a lot of us are going to have a chance to get back over here because Dr. Mitz told me today he's going to let us come back to see some other areas of his work in the fields of plastic, reconstructive, and hand surgery. Dr. Mitz, I really thank you for letting us come over today, and as you know, I always like to have our viewers learn more about your educational background and training before we get into our subject of cosmetic surgery today. Could you tell us a little bit about where you trained before you came to the Yuba City, Marysville area?
I did 4 years of medical school down at Loma Linda University outside of San Bernardino, and then I did 5 years of general surgery following that. And then I finished up my plastic surgery training at the University of Indiana.
It's quite a few years of training after medical school.
It's a long time.
It takes quite a lot of experience in these procedures to really be qualified and become board certified in the field.
Yes, it does.
So you're considered plastic surgeon, facial, cosmetic surgeon, hand surgeon, reconstructive surgeon, all fits into the area of being a board certified plastic surgeon.
That's right.
Tell us about some of the procedures that you do that are considered cosmetic surgery procedures.
Well, probably the most common that we do and deal with either the face or breast surgery. And the facial surgery would include blepharoplasties or the eye lifts.
Where people have the droopy eyelids that come down and you're able to make them look a lot younger.
Exactly. Then the facelift, where we take the lines and sagging from the face. We're also doing now some of the permanent pigmentation for the eyeliner, the eyebrows, doing some of the collagen injections for the wrinkling, some dermabrasion or sanding for the wrinkling. And then we do a lot of breast surgery, uplifting, enlargement, and so forth.
When you do, let's talk about that eyeliner procedure because that seems to have been in the publicity a lot lately in newspapers and magazines. Is this done for people who have lost their eyelashes or eyebrows and you're trying to replace the look, or is it done for other reasons?
Well, with the eyeliner, it's basically that it's augmenting or enhancing the follicles themselves, the lashes. It really doesn't pigment the lashes. It's at the base of the lash. And a lot of the women that are busy wanting to get up and have their makeup on and have to hurry out of the house like to have that eyeliner on. It's waterproof, obviously, so it won't wash out when you shower or swim. Other women that are allergic to medications or other makeup, for instance, and can't wear certain types of makeup, can also have the eyeliner put on and have no difficulty with the allergic reactions. Women that wear contacts are really very fond of the permanent eyeliner.
They don't like to get that makeup in their eyes and have to deal with the contact lenses. Right. It must be a little bit, actually a lot, important that people realize they can't change that once it's in there.
That's right. You can't change it unless you want to cut that line out and start over again.
So it must be a pretty intense counseling session before you'd actually jump in and just start doing that procedure.
Yes, I don't do too many, but often enough that there is some demand for it here in town. But I'm pretty careful that they know what they want before we go ahead and do it.
Right, I, as you know, have seen people with tattoos on other parts of their body that later on decide they don't want them there. So that really is crucial that they know what they want before they jump into something.
It's impossible just about to reverse.
We don't want them to get in that situation.
No.
Well, other procedures, such as the facelift, is a procedure that can really make people look a lot younger, maybe feel better about themselves. Is it a difficult thing for a patient to go through to have a facelift?
No, most of them are done under a local anesthetic with some sedation. They're done as outpatients. Depending on how much is done, may take from 2.5 to 3.5 hours. We include the eyelids along with that. And the recovery time is basically about 7 to 10 days for any bruising that they might incur. As far as any post-operative pain, it's minimal, if any. And most of the ladies get along very well both during and after the surgery.
How long these days is it considered to be an effective procedure? In other words, how long does the actual improvement stay there in most people?
That's a question everybody asks, and I don't know where this came from, but the rule of thumb is about 10 years.
Really, 10 years? I've heard all kinds of numbers, so I'm not sure where they come up
with. If you find out where they came from, let me know.
Can't find it in any specific research article in one of the journals. They just don't.
No.
No one's really studied that.
Not at all.
Is it true that working on the chin and the neck is a more complicated procedure for a plastic surgeon?
Yes, particularly because now, several years ago, they introduced going underneath the muscle layer of the face and tightening up all of the muscles to give you expression. And the public has become aware of this, and many of them want that type of surgery. And it's difficult to explain to them that some people are candidates for it and others are not. One of the things that does help a facelift, though, is if we can augment the chin, if there's a need for it, it helps to drape the facial skin much better if they have a nice prominent chin.
To make you a little more noticeable, I see. Right. I understand you're doing another relatively new procedure that's been introduced into this community called liposuction.
Yes.
What exactly does that mean, liposuction?
Basically, it's a very simple procedure that I wish I'd have thought of myself. And what we do is we make small incisions, and using a narrow metallic tube, place it underneath the skin in the fatty layer, then hook it up to a suction machine, and whatever loose fat there is underneath the skin, we can suction out and actually contour that part of the body.
I understand that can be done in the chin as well?
It can be done in the chin, face, breasts, belly, thighs.
Do you ever combine that with other procedures, like in the abdomen, to take the bulging away and do the surgical procedures with that?
Yeah, I often do, because I found that it makes my job a lot easier. For instance, doing the standard tummy tuck, pulling all the skin down. If I thin that apron of skin and fat down with the liposuction, then I get a much better molding, and it's much easier for me to take off more of the excess skin. So I usually do that first and then go ahead with the standard operation.
If someone comes to you to discuss one of these procedures, they shouldn't expect to have the surgery done the first minute they walk in your office.
No, usually it takes 4 or 5 weeks before I can get them scheduled, particularly if there's any desire on the patient's part for another opinion, which I often encourage. These people are consumers, and I want them to be happy with what they get. So if there's any question, I give them names of other plastic surgeons and have them contact them.
What happens during the initial consultation appointment when a patient calls up and they're given an appointment to come in? What goes on during that time?
Usually I spend most of the time just trying to get to know the patient personally. I'm not terribly interested in what their profession is and other background. I'm interested with a cosmetic patient and how stable their personal life is, because cosmetic surgery is not a remedy for what's bothering you at home or bothering you at the job. And I have to make sure that these people don't have unrealistic expectations of what's going to happen once they have the surgery.
You're not going to make an 80-year-old look like she's 19.
No, and I'm not going to bring back an estranged spouse by any kind of cosmetic procedure.
Have you ever turned people down?
Frequently do.
That's interesting. Most people think that we're just eager for patients to come in, but there are times we just have to use judgment like that.
If they're looking for some unrealistic goal, I'm never going to make them happy, and I don't need that kind of patient, and they don't need that kind of surgery.
I've heard that you've recently acquired a computerized device that lets you look at people and change their appearances on a computer TV monitor so they can see what some of the effects of the surgery might be for them. Is that something you have here?
Yeah, that's my favorite new toy. Right now, as far as I know, it's the only one that is in color in place in Northern California.
What's it called?
It's called the Imager, basically. It's a computer imager. It was made by a company that supplies a lot of the medical prosthesis and so forth that I use. It's developed specifically for plastic surgeons, although you may have seen a version of it like on Donahue and some of these other shows.
Could you actually take a picture of me and change my face around a little bit and see what would happen?
Sure,
As long as the viewers don't laugh too much, why don't we check it out in that part of your office?
All right, love to.
We're now in Dr. Gordon Mitt's special imager room. It's fascinating to me to learn that this is a very unique piece of state-of-the-art equipment called the imager, used in a plastic surgeon's office. This piece of equipment is an extremely powerful tool for a plastic surgeon and actually costs $25,000. So you won't see too many of these in the community or in Northern California, and it's my understanding this is the only one in Northern California right now. What Dr. Mitz is going to do do is actually have me pose as a patient and see how he can change my appearance using plastic surgery. Hopefully he won't find that I need too much work done.
I'll send you a bill. Okay, Bob, I need you to just get a profile here until I can get you captured on the screen, and then you can move. This will actually allow me to change the contrast, the color, and everything as you would on your own TV at home. And once I get the image, then I can store it for as long as I want to on the memory of the computer. Right now what I'm trying to do is get the flesh tones. And dial you in here, then I'll freeze you, and then you're ready to go. Is there anything particular you'd like to have done?
Well, why don't we consider nose work, maybe taking the little beak off or the big bump on the nose, that sort of thing.
Okay. All right, you can move now. I've got you.
Oh, look at all those blemishes showing up on my skin. I don't know about this.
Now what I usually do is, to make a before and after picture for the patient, I trim it down. And then I usually make a copy so that there's a side-by-side comparison.
Actually, can we start up on my forehead and see what I'd look like without my bulging forehead there?
Sure.
They said that the reason I have that is the extra brain tissue grows as you use it a lot and makes it stick out like that.
That's a likely story.
Actually, another person told me that was due to holding my nose when I sneeze. Made the sinuses bulge there. Can't get him to laugh. He's too serious.
Well, I'm seeing double right now. So, there's 4. We'll make a copy for afterward. This thing will jump all around. My magnetic personality or yours, I guess. Have a little magic wand here that when this thing becomes magnetized, you can demagnetize it. This pad that I'm writing on is a digitizer pad, and it does all the work for me. It gives me all the menu for everything that I need to do. I rarely have to go back to the computer at all, except right then to do any functions of the imager. This thing was so new that when I got it, there wasn't even a user's manual published. So I had to learn this by trial and error. And then finally, after I went through a lot of error, got the manual.
You can actually store different patients in here, can't you?
Sure can.
And then you could come back later and compare them after the surgery to before.
I often do that. Or the other way it helps me is like before surgery, I don't have the patient right there, but I can come back to the imager and I can actually do the surgery. And sometimes I'll change my mind.
Right in your office planning it before you go in
I
the office.
decided, no, that doesn't look quite right. I don't want to do that. The other thing I can do with this thing is to magnify any part that I want. That.
What can you do for those crow's feet I'm starting to get there?
Oh, I'll show you. You can do everything. That's one thing that you have to be careful with this machine, is that sometimes you can do more with the machine than you can surgically. And you need to have someone that knows what the limitations of the machine and of the surgeon are. This is using a blur brush or a blend brush, and what it's doing is just taking out those crow's feet. The computer is making an average of the two colors in the adjacent areas. And this is a real simple trick for this machine.
It's a lot more difficult to actually do that type of procedure, though, isn't it, surgically?
Yeah, it takes me a little longer.
Well, maybe those crow's feet give my face some character. Maybe we should just leave them in.
Leave them there. Okay. Okay, Bob, one of the other things that I can do is, we were talking about doing your nose. I can use a sculpt brush mode to trim down part like that. I can also use a scale mode to make it smaller, bigger. Can use a taper mode to lift the tip.
Well, let's try that. Let's assume I came in here and you'd want to show me what you could do to my nose.
Okay. Well, I think the first thing that we'll do is we'll put it in this nose profile mode, appropriately named, and and we'll magnify this one area here, and by pressing down on this little drawing pad with the sculpting brush, I can trim down if there's a dorsal hump. Trim it down a little bit, much like we would do with a rasp and file during surgery. In fact, a lot of the things that you do with the imager really repeat the sequence of events that you follow in surgery. Take the blur brush, smooth that profile out. And there you are with a somewhat different shaped nose. Tip is up a little bit. This is trimmed down, so I'm just a little bit off of the dorsum there of your nose.
Now, I'd like everybody to look at this very closely and send me your cards and letters about whether you feel I should go ahead with this procedure. Hopefully, you won't tell me to do that.
And send contributions. The other thing you can do is, I was telling you about enlarging or making things small. For instance, a lot of people will ask me what a chin implant involves, and they really don't know what the difference would be in their looks if they had their chin enlarged. And so often what I do is I take a picture of them as I have you, and I go into the scale mode. And what it does is it makes a little box, and it enlarges it in any direction that I want it to be, either up or down, sideways. And then when I get to a point where I think that might be large enough, and again, this is trial and error, then it enlarges it. And then what I do is just go and smooth all of this out so that we don't have any step-offs. And after a lot of procedures on one particular picture, if you look at it under magnification, it starts looking like a portrait. You almost see the brush marks. And then we'll blur this roughened outline out. And there you are with the new chin. And this is helpful for me because a lot of my patients, when they want a rhinoplasty or nose job, really need a balance between the new nose and the chin. And sometimes if they want their nose made smaller, their chin is too prominent for much of a reduction. And it's hard to explain that to them, but they've already got a good balance. And so those patients I don't operate on.
Interesting.
On the other hand, if they have a big nose and they have a small chin, I know they're still not going to be happy until they have that balance between the two. So this way I can show them what they'll look like, at least what we'll try to make them look like. Sometimes they agree and sometimes they don't. If they don't, then give them a name of somebody else to go see.
Can you smooth down my little bump up there?
Oh, sure. We'll use a sculpting brush up there.
Now, is that something that surgically could be improved?
It could be. Recently what they've been doing is taking a sander, looks like a dermabrader, and making an incision in the eyebrow and going up and just sanding this down.
And you don't have the sinus under there. You're so
No, you have to be real careful. But it's pretty thick right there in the frontal bone. And that's becoming a more accepted cosmetic procedure.
I think that's not bad.
You like that?
That's right. So tell me, what other, we've seen how we can improve the look of different wrinkle lines, we can change the nose, the chin. What other things could you do in this facial projection with this device?
Well, as I showed you, for instance, with the eyelids, and show them what the blepharoplasty would look like. You can also show them what the upper lids would look like by making a copy of the lids and moving the whole eye upward. Sometimes a lady has a drooping eyebrow, and show her what she would look like with a brow lift. A lot of people don't realize what that would entail and don't understand it. And some people it makes a dramatic difference. I can show people, for instance, what they would look like with scar revisions. So it's not strictly cosmetic that I can use this for.
So reconstructive aspects too.
Right. Again, with a chin, with a facelift, I can show them the wrinkles being gone. I can sculpt their neck if they have a sagging neck in the front. A particularly good view is a side view like this, using the sculpting brush and sculpting this away.
Now, not only faces, we're not going to see it today, but you can show breast enlargement, breast reductions,
right.
Other parts of the body, buttock, abdomen, all of this.
Thighs with the liposuction is a very good application, showing what their thighs would look like with the reduction.
And all of this would be strictly confidential for your patient.
Right.
You wouldn't have Dr. Peppercorn's medical explorer coming over to see their pictures.
Right. And the other thing is that, and the aid to the confidentiality is that if I want to, I can make a separate file of all of these images by putting it on a separate disk, which I can keep at home in a safe or in the office in a safe. And so I keep a permanent record, and nobody is privy to that record at all. They can't run this. Like nobody in the office could run this but me anyway right now.
How long have you been in the community now, Dr.
This is going on 3 years.
3 years. You do a lot of your work in Fremont Hospital and in Colusa now. Have you found advantages for people in town to do the work in Colusa?
I think because of the remoteness of the hospital, even though it's only 20-some miles, a lot of people want to have cosmetic type surgery done and they don't want everyone to know about it. And it's much easier to keep it confidential out there. They're a little more geared to taking care of cosmetic patients, catering to them a little more. All my patients have a private room. They get flowers after surgery and special dinners, and really get the red carpet treatment out there. So
they can have their family come and visit them out there.
Sure can. In fact, there's a bed and board place that they have now right down the street that can actually be included in your bill.
Wow. That's unique.
Yes, and so it's become quite a resort type atmosphere out there for my patients, and they all seem to like it quite a bit.
And that's been going on for several years out in Colusa as well?
Just a little over a year.
A year there. Interesting. Well, we should talk more about that sometime.
I'd like to.
What I'd like to do is come back again after you've really been going with this device and hear more about it. Maybe you'll come back a year from now and tell us some of the interesting stories you've come up with this machine.
Sure, I'd love to.
Thank you again, Dr. Mitz.
Thank you.
Well, that's our program for tonight. I would like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see here on the Medical Explorer program. As you know, the Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Medical Group at 367 Del Norte Avenue, 95991 in Yuba City. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices right here in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.
Problems ranging from baldness to cancer.